right, Joe. I'm really excited about this week's podcast. I think it's going to be the coolest podcast we've ever done.
That's for sure. It is definitely cold and we're dressed for the part. We're not in our tank tops this week. We are in Florida still, but we both traveled yesterday a little bit. We were in Orlando and coldest I've ever been in Orlando, I will say. And here I am back in Jacksonville and my pipes froze last night. So everything's running again. I'm able to take a shower if I need to, but we're bundled up for the time being.
Yeah, we figured we'd dress appropriately for the weather, but also since your pipes are frozen, you couldn't shower anyway. So here we go, right? And we
Yeah,
were
we
all
look fine.
we were all dressed up last night, though. We were down in Orlando at the Physician Society of Central Florida annual meeting and gala, and had the opportunity to see Dr. Benjamin Kaplan inducted as the new president of the Physician Society of Central Florida. So it was a great night. Appreciate you emceeing, and we raised some good money for their foundation. So it was a good evening overall.
Yep. And I had the bow tie. People who know me at those kind of events, sometimes I wear a bow tie, sometimes I wear a regular necktie. But it was yeah, like you said, it was a great night. We had immediate past president of the FMA, Lisa Cosgrove, was there. So it's always good to see somebody that bounces around the state and makes time for all the county societies. So it was good to see her there last night as well. But now we're bundled up. We took the neckties and bow ties off and ready to talk Tallahassee, right?
Yeah, definitely. And maybe later on in the program, we'll kind of revert back to a conversation you had last night with one of the residents about one of the scope issues we're going to look ahead to for next week, too. So we'll circle back on that one. But let's get started with these headlines for the week.
All right, let's go. And as we're dressed for the cold, people might notice the headlines are ready for the cold as well. So here we go. As we do each week, we talk about three headlines and kind of break them down a little bit. And as we ask each week, if you have any questions, if you have any comments, leave them in the comment section, and we try to address those the following week. But out of the gates, here we go. The first one: House advances expanded use of office-based procedures, but will increased cost have a chilling effect? Chilling effect. You heard that, Fraser?
Yeah, yeah. Thanks for that, Joe. Yeah, this bill kind of we weren't tracking it, and that's one thing that happens during session. You kind of think you know the playing field, and then random issues pop up out of the blue. This was one that Tony Large, one of our lobbyists up in Tallahassee, and I were working with Chris Newland on last week as it emerged and was going to be scheduled for a hearing. So that really elevated our focus on it. But the big thing it's doing is it's currently with office-based surgery. You can only have four patients undergoing treatment at the same time in the same facility. This would expand that number to six, which is a good thing. There's been a lot of pressure federally trying to push through the fee schedule, the Medicare physician fee schedule, to push more procedures that can be done appropriately in an office-based setting out of those high-cost centers like the hospital and the outpatient departments. So, with that in mind, expanding the number of cases that can be done in an office-based surgical suite, is a good thing for our physicians. On the flip side, though, where it could get a little dicey, is it does ask the state to come up with new building code standards for office surgery suites that would take effect in October. So the bill still has to go through the Senate. It just passed its committee, first committee in the House this week, which is why we were taking a look at it. But again, something to keep in mind for those doctors that do procedures in the outpatient setting, or sorry, in their office-based setting, maybe some expanded opportunities that are going to come down the line, but potentially at a bit of an additional cost. It wouldn't be apply retroactively. So if you've got a current office-based suite, you're not going to have to all of a sudden come up to new building codes, but it's for new suites built after that date if it takes effect. So something to watch.
Well, that's one of those examples of something that we try to plan everything out and know what we're going to be seeing throughout the session, and then things come along. So it's you have to tune in every week because there's always going to be something that pops up that's seemingly out of nowhere, and then it could have legs and go a long way. So, any last thoughts on that one before we move on?
No, I mean, obviously, just out of nowhere, Maisie is probably a bit of an exaggeration because we know all the bills were filed, but there's thousands of bills filed during session, right? And until they start to move through the process, then we really start to actually look at these things. And that's one that was hanging out there, started to get movement. So we're like, oh, we better dive deeper into that. And that's one of the cool things about sessions. You really never know what issues are going to get traction. And that's why we pay folks up there to mind the shop to make sure we are aware of all the different things that could be potentially moving during session.
Yeah, it's kind of like the baseball season starts and the big players, then all of a sudden somebody that wasn't expected to be a star kind of gets the spotlight. So same thing happens in session. So All right, well, let's move on. The number two is something we have been talking about a little bit over the last few weeks and months. Big, beautiful Healthcare Frontier Act moves in the House, but will it meet a frosty reception in the Senate?
And we got Frosty into that headline too. I like that. Yeah, we've been talking about this for a bit, but as we talk about it, we really usually focus on the big headline of this, which is the bill would provide autonomous practice for APRNs across all specialties. So it would eliminate the primary care restriction that's currently in the Florida statutes and make it kind of open for APRNs to practice any specialty that they have training in. So that's been the real headline, but there's some other things buried in there that we think is important to mention. And again, it just passed its first committee this week. It's got another committee go on the House side. And over on the Senate, they haven't really signaled an interest in taking up this bill for the most part yet. So we'll kind of see what happens with the reception it gets over on the Senate. But the other pieces worth mentioning that are in that bill, it does repeal all certificate of need, all CON for all facilities. So nursing homes being one of them. So I know that's an area of major concern. If anybody can hang a shingle and create a nursing home on a street corner somewhere, they have other standards they have to meet too. But really dialing back regulation on how many and where these nursing homes, assisted living, hospitals, and everything can be. So that's one area of debate in Tallahassee. Certainly, there's strong advocates on both sides of that. There is a requirement in there that requires referring physicians to inform patients if the doctor you're referring the patient to is in network or not. So we've always complained that that is a burden that should be borne by the insurance company and the patient, not the referring physician's job to know if that doctor is in network or not. One thing I know is of a concern is a lot of health systems try to make sure all referrals are done in-house and no referring to community-based doctors. Again, I think this would increase the pressure on physicians just to refer in-house because you kind of know if they're in the same system, they're in network, right? So
Right.
it's probably another bit of a challenge for community-based doctors trying to make it out there on their own that aren't associated with a health system. So something to watch there. Of course, we have concerns with that and think that really is up to the patient and the insurance company to make sure that in-network information is available. And finally, one thing it does is currently physicians in Florida can supervise up to 10 physician assistants, but there's a hard cap of 10. You can't do more than that. The bill would actually say you could supervise as many PAs as you want. So you could have a team of 30 out there if you wanted to, as long as you felt comfortable that you could provide proper oversight and everything too. So just worth mentioning that additional expansion. But again, it's got a long way to go. Not sure how the Senate's going to feel about this bill, if they're going to give it a hearing in whole or in part. So we'll just kind of see what goes over there on the Senate side.
Well, those are some good details that you broke down there, and obviously a lot of those details are what have to come together as this bill kind of moves along. But the in-network factor that you were talking about there, that's one of those things where when we go over with doctors and we talk to the legislators over there, that sometimes they don't realize all that staff time and all the just actual consuming energy that it takes to do those kind of things, and they just kind of pop it in a bill, but they don't realize all the factors that are in play when you're talking about trying to figure out who's in network and things like that. And like you said, maybe that shouldn't be falling on the doctors and the doctor's
Yeah.
staff.
Yeah, I'm sure most doctors have their bread and butter referral patterns with their colleagues that they know and have comfort levels with for different specialties. But knowing what insurances they take and don't take is a whole nother level of engagement and forethought that would have to come if this bill does take effect. So again, we'll keep you guys posted as it moves through the session.
Right. We've got a long way to go, and I'm sure there will be a lot of twists and turns as we make our way. All right, ready for headline number three, right, Fraser?
Yep.
All right, ready in a flurry, legislation would expedite patient access to medical records. We had some flurries up here in Northeast Florida. We were so concerned about our pipes freezing, we didn't hop in the truck and go look for flurries this morning. But I saw plenty of things on social media of my friends and family that saw flurries in their Jack's Beach backyards last night.
Yeah, it got close to where we are in St. Pete too, but I think Pasco is as far south as it got, maybe a little bit into Hillsborough. But as far as access to medical records, currently the law in Florida does require physicians and hospitals and others to give access to patients of their medical records. This really elevates the focus on that issue because it requires it within certain time frames. So the bill, if as currently proposed, says you'd have to provide access within 14 days. And that would be an actual copy of the medical records, and the patient could ask for it to be in electronic format, and you would have to comply with that. Of course, you could give it to them in written format if they're all right with that. But also a 10-day time frame to make just the records available for examination. So again, if somebody, a patient or their representative wanted to come in, you could actually show them their medical record within 10 days, but you'd have to produce a copy of it within 14. So there's both federal and state law dealing with access to medical records for patients. This really just elevates the time frame and when that compliance needs to happen. And something in a massive, big, busy practice. You've got time frames to monitor when you provide it. It does, like you mentioned on the last one, increase administrative cost and burden, and something for the practice to be aware of. So we're watching that. We have concerns with it. It's really the strict deadline that gives us the most heartburn on this.
Yeah, well, and those are really important things that we think about on a daily basis, and obviously all the physicians across the state of Florida think about it probably multiple times a day. You know, whether you're worried about staff time or you're worried about your own time, there are a lot of factors at play when you're treating a lot of patients.
Yeah. Yeah, luckily patient portals and things like that are becoming more commonplace, as everything's more, everybody's adopting technology. But again, it is a regulation that bears, monitoring if it does pass. So.
Very nice. All right. Well, what any last thoughts? Anything we need to talk about looking ahead, Fraser?
Yeah, things are going to warm up next week, both at home and in Tallahassee. So there's a few bills actually that are going to be heard for second reading on the floor of the House next week. The CRNA independent practice bill, and also the psychiatric nurses independent practice bill for the APRNs. Those two bills, have been moving through the process clearly. They're ready for the House to address. There's no movement over on the Senate side in those, and everybody's kind of, while those two are moving, everybody's kind of looking at the Speaker of the House's priority, his big frontier bill, which it would accomplish the same thing. So it's kind of weird that you got two independent bills moving and then the big one out there. So anyway, those are ready for floor action. We think they're going to pass by an overwhelming majority. So that's just a reality. Again, the real challenge on this is going to be over on the Senate side. And then one other one, the use of professional titles, which we support, that bill. It just requires, if you are a non MD or DO and you're going to use the term doctor, like if you have a PhD, you have to say what you're a doctor of. So if it's a doctor of nursing or doctor of physical therapy, you can't just call yourself Dr. Joe. So anyway, something we support, just a little bit of transparency, and that'll be heard on the Florida House next week as well.
I used to, this is just a side note. I used to play a lot of darts in the bar, and there was a guy that I played with. He was a old journalist, and he used to call himself Dr. Bullseye. But he was not a doctor. He was not a medical professional. So we called him Dr. Bullseye, but he was not a doctor.
No, but good as his trade anyway.
Yeah. Well, and speaking of actual doctors, last night in Central Florida, we had a chance to talk to a medical resident down there in Orlando who actually went to he's a psych resident and went up there to Tallahassee, and he was kind of getting to see how the sausage is made, and that was exactly what we were talking about, the psychiatric nurses and scope of practice and everything. And just we stress the importance of the next generation of physicians. Now's the time to get involved, and like the people who are kind of getting toward retirement, the laws are going to change a little bit by the time they retire. But think about someone who's finishing up their residency, in the time from now until he retires, a lot can change as far as the laws go, and he's seeing that incremental change right now, just by those little things that are happening over in Tallahassee.
Yeah, and when we get residents and med students involved in advocacy, it makes a huge difference in Tallahassee too, because the legislators recognize that the dedication of time and resources that these young professionals are making in their future and want to make sure they have a bright future here in the state of Florida. So when they speak, it carries a great deal of weight in Tallahassee. So I'm glad he did that, and we can continue to get others going up there to do the same.
And the residents, the medical students talking about the amount of training that they get and the experience you get when you're in that hospital system, learning from attending physicians. You can't replace that, obviously. So, the team environment is great where you're all lead up to a doctor at the top, but having that supervision from a doctor is absolutely important, and there's no training like those medical residents are going through. So more power to you if you're whatever step of the process you're in. It's a very important process, and when you come out on the other side, you're trained sufficiently for sure.
Definitely. And we didn't rig it so he could win the raffle prize last night, but he was excited, super excited. He won the Orlando Magic $2,500 ticket package, so him and his wife can enjoy that with their young family. So we appreciate him coming out and his leadership.
He's got a bright future. All right. Well, speaking of futures, anything else, or can we move on to the musical segment?
We're ready for the musical segment.
All right, and this is kind of a story too. I'll make it really quick, but I had a dream the other night about a band that I really like playing a concert in the state capitol, and so I was immediately like, "Oh, we have to use that band this week." But then when the cold came in, sometimes you have an ace up your sleeve, and I have not mentioned this band yet. But if you know me, you know that I really enjoy the band Fish, spelled with a PH, Phish. And one of their biggest songs of all time is Tweezer. And there aren't many lyrics, but it's all about stepping into the freezer and it's going to be cold, cold, cold. So give that song a listen. The real exciting part about that song is when you find a live version. They usually go upwards to 30 minutes long. So give yourself some time if you're going to listen to Tweezer by Fish. But it's all about being cold, and that's what we are this weekend. So I'll save that other band for no, a more warm week when we can talk about them a little more.
Yeah, and 30-minute song. That would be a good way to spend a cold afternoon here in the state of Florida today.
Yeah, maybe put a log on the fireplace and put Tweezer on the radio and enjoy the cold weather inside this week. But hopefully it warms up, Fraser, and we'll have a lot more to talk about next week. And any last thoughts before we say goodbye?
Nope, just looking forward to getting back with you next week.
All right, see you then, Fraser.